My name is Heather Lister. I'm 47. I'm a realtor. I've been married for almost 21 years. I have a son who is 17 and a junior in high school, and a daughter who is 14 and a freshman. I'm very involved in my community, the schools, our neighborhood. When I was born, I was diagnosed with a heart murmur and was checked every year. And it wasn't until I was married and in my 20s that I decided to take charge of my health care, and I found a cardiologist. He told me that I actually had a bicuspid aortic valve. More recently, I couldn't catch my breath as easily as I used to. I felt tired, and I just didn't feel right. I just didn't feel right. So I sought the opinion of the cardiologist, who told me that my valve was fine and he would see me in 2 years. I just wanted to be sure, so I wanted to get a second opinion.
Heather came to me for her valve, and she had been told on the outside that she had nothing to worry about. But some patients who have a bicuspid aortic valve also have an abnormality of their aorta, which was a very big surprise to her.
No one had ever mentioned a connection between my valve and the possibility of an aortic aneurysm.
An aortic aneurysm is a condition where the aorta becomes enlarged. So when you have an aneurysm, the layers of the aorta can become weakened, and they're prone to either tearing or even rupturing. And that can be obviously catastrophic. Her aorta is definitely dilated, and her number for her aorta is 4.5 centimeters. Typically, we operate when the aorta reaches 5 centimeters when you have any family history of an aortic dissection.
My dad died when he was 44. He had had an unexplained cardiac issue. My aunt, at 60, passed away of an aortic dissection. And my uncle, my dad's brother, also had had an aortic aneurysm. I feel like I have a ticking time bomb in my chest. Honestly, what scares me the most is for my aorta to rupture when I'm home alone with my kids. I want to keep living my life, but I'm terrified.
She's got that fear. I have the fear, knowing what her family history is. The current guidelines do not index the aorta to body size. So if you're a larger man, your aorta is known to be bigger than a smaller woman. Heather is very petite. So although she has not met the 5 centimeter criteria, her aorta is bigger for her size. I'm not comfortable just sitting on her case and following what the textbook says. So we are coming up with a plan to individualize her care.
Heather?
Hi.
How are you? I'm
Hi.
Dr. Amash. I told Heather today that she's going to have an operation at one point in time. Whether it's going to be in next month, next year, 2 years.
That's the aneurysm.
Heather asked me a question today, said, Dr. Amash, why don't you operate now? Why do you need to know more information? I said, well, although the risk of an aortic operation at Mayo is really, really low, you never know when somebody's going to have a complication related to surgery.
So obviously we don't want to operate before the right time, but we don't want to wait too late.
Even though it's stressful, I believe that the knowing is a huge step in getting better. Dr. Landolfo recommended genetic testing. It does make me feel empowered because I can help my kids through that process, and we know what to pinpoint to see if they're at risk. I think this whole experience has given me a passion about advocating for yourself. When you know something is not right, you need to fight to be heard. And for whatever reason, my body was speaking to me and told me that this was for real.
You'll have regular follow-up here with me.
Mayo Clinic has just been a place that's been very comforting to me.
I'm in there with you.
Okay.
All right.
Thank you.
Oh.
And I just feel like I can take a sigh of relief and know that I'm being taken care of.